Hi. So today in our series looking at mental health conditions, I want to take a look at serious mental illness. And serious mental illness is the group of conditions that includes things like schizophrenia and bipolar disorder, illnesses where there is psychosis, and I'll explain that as we go on. And this group of illnesses is serious in lots of different ways. It's defined, illnesses in this group are defined by causing an inability to function in some way. So there's some impairment of what we call functional ability. And that can be things like difficulty just looking after yourself, self-care, difficulty getting to work, doing the things you'd normally do, looking after children, functioning in day-to-day life. And in these conditions, there's often a marked impairment in those things and ability to do those things. And that can be a marker of the illness. So I thought we'd start by just talking a little bit about psychosis. Psychotic or psychosis is not a diagnosis in itself. It's not actually an illness in its own right, but it's something that we often see in the serious mental illnesses. And it's basically an experience that the person has, or a symptom that the person has. And it could be defined as losing touch with reality. So that the way that that person is perceiving things around them, or interpreting what's happening around them, is different to what everybody else is experiencing. So there's a disconnect in their perception and in their way of thinking that becomes not understandable or frightening often in some way. And it's this experience or loss of reality, disconnect with reality, that we call psychosis. Now, psychosis can occur with these serious mental illnesses. It can also occur with things like drug use, illicit drug use. It can occur with some other illnesses, other brain illnesses, neurological illnesses, or infections. So it's not purely in the mental health conditions. It can occur in other things, although it's less usual for that to happen. So there are two main groups of serious illness that I wanted to look at. One's schizophrenia and one is bipolar disorder. So let's start with schizophrenia. And it was interesting when I had a little look at some of the websites just to see what they said as a definition for schizophrenia. And here's three. It's a serious mental illness, it's a brain disorder, and it's a severe mental health condition. Now, it's interesting to me when I read those that actually that doesn't tell me a lot. That is just descriptive. It describes what's going on, but it doesn't give us much clue about why it's going on, what it involves, or how we can help it. And it's like that for a lot of the mental health conditions, that they're descriptive. They're a group of symptoms that are put together to make a diagnosis of a condition. So in schizophrenia, we're looking at a group of symptoms that we put together and we say, yes, there are these different symptoms present, and so we think this person has schizophrenia. And in that group of symptoms, there are two things to look at. One is what we call negative symptoms, and the other is positive symptoms. So in the group called negative symptoms, it's things that take away from that person's quality of life. So things like not being able to function, not being able to look after themselves, not being able to think straight, feeling slowed up, a sort of a taking away of things from the person. Negative symptoms. And then we have positive symptoms, which we probably would all associate more with schizophrenia. And there are three things: what we call hallucinations, delusions, and then disorganized thinking and speech. So let's start by looking at hallucinations. Hallucinations are to do with our senses. So we would often think about what we call auditory hallucinations, or hearing voices. So in schizophrenia, the person may often hear voices that other people can't hear. And those voices they're hearing within their own mind, if you like. and other people wouldn't be able to hear them. Other kinds of hallucinations can occur as well. So visual hallucinations, where you're seeing things that are not really there. So for example, I can remember when I was working in psychiatry, seeing patients. One patient I can remember particularly was seeing little alien people in his house and in his garden, and they were very frightening for him. And for him they were real. For him, he could really see them, but nobody else could see them. Or I've had a patient who could see insects crawling on the walls of the house, and they could really see them, but nobody else could. So they were seeing something within their mind. I mean, I suppose we do that with our imagination, don't we? But this is just much more powerful, much more distressing for the person. It's often something that you wouldn't expect to be in that situation. So it seems very odd and unusual. And it may be for the person who's suffering from schizophrenia that they don't fully understand, they don't fully get the unusual nature of that. To them, it's so real that they think it's bizarre that other people can't see it. You can also get hallucinations to do with taste and to do with smell, smelling something that's not there, or feeling sensations on the skin, something crawling on your skin that actually isn't happening. So it can occur with all of the senses. In terms of the voices with schizophrenia, they're often negative in my experience, although they can be positive. The positive ones can be things often around what we call grandiose ideas. So I had a patient who was hearing voices that was telling them that they were the new world leader, and that they had a new order that they needed to bring in, and it was far superior to anything that was here. And it was all these ideas about how they were going to rule the world. So in a sense, you could say that that was a positive voice. However, often the voices are negative. They're often frightening. They're often about death. Sometimes telling the person to kill themselves or kill somebody else can be quite menacing and condemning and disturbing, very disturbing for the person. So that's the first group of symptoms that we often see, that are the positive symptoms, hallucinations. Then we have delusions, and delusions are to do with belief systems and our thinking. So delusional thinking, again, it doesn't fit with reality. It doesn't fit with what we know as being the actual way things happen. So a person may be deluded in thinking that there's a whole network of people who are out to get them, that there are spies looking for them, that the person on the bus is spying on them, that the television's bugged, that they're paranoid, this paranoia that people are plotting against them in some sort of way. And that's quite a common delusion. So delusional thinking, it's about the belief systems and how the person is thinking. And then we have the third thing, which is this disordered speech and disordered thinking, just all over the place. And it's often very difficult for family and friends to sympathise, empathise, understand how the person is thinking like that, because it seems so obviously different to what they know as real. And again, that's a marker for these serious mental illnesses, that it's very difficult to sympathise, it's very difficult to empathise. And family can feel that the person's just being difficult or just being awkward, because they can't understand how it is that they can possibly see things and hear things and think things that are not real to them. For the person who it's affecting, it is real, and it can be distressing, and it can be frightening and dangerous as well. So that's a sort of overview of schizophrenia. I think one of the things I just say in here as well, in terms of these serious mental illnesses, is that there is often a real effect on physical health, and partly because of the lack of self-care, and partly because of some of the medication that's used in schizophrenia. And similar conditions, there can be an increased risk of things like diabetes and heart disease, lung diseases, some cancers, and actually we know that people who suffer from these illnesses die younger than people who don't. So when we're thinking about helping people, it's really important to bear that in mind, that this is about the whole person. It's not just about their mental health, it's about physical health as well. Now, in terms of treating schizophrenia, we often use medication, and we often use medication that's called antipsychotic medication. So it's working to reduce the psychotic symptoms, reduce the voices, reduce the distress, to help that person function again, and to keep them safe as well, to keep other people safe. The one there's lots of different ones that are used, that are available, and they've been around for many years. There's quite a lot of debate at the moment, actually, about whether medication is the right way to go when treating these kind of illnesses, and that's partly because for a lot of people they would say that medication ruined their lives, that the side effects and the other effects from it ruined their lives for them and stopped them thinking clearly and stopped them recovering well. There's other people who'd say the medication saved their lives, so we have to steer a fine line. However, there is quite a lot just recently looking at other forms of help for people with schizophrenia. And interestingly, on BBC News in February of this year, there was an article from Norway where they're looking at specialised units that don't use any medication to help people with schizophrenia type illnesses, and looking at other ways, other therapies and talking therapies and dialogue and other ways of helping people recover. And I think that's quite exciting and interesting. There was another project in Finland, I think it was called the Open Dialogue Technique. And in Britain, we've got something called the Hearing Voices Network, and a consultant in London at University College London called Joanna Moncrief. And she's written a lot, she's a psychiatrist there. She's written a lot about medication and what's behind it and the drug company involvement, and does it actually serve in the patient's best interests. So her work is quite interesting to look at, and look up a little bit about what she says. And again, I think that within the UK, there's looking at other forms of therapy, other things that are important in helping people with schizophrenia and similar illnesses. So I'd really encourage you to have a little look at that. I think it's really important within medicine and within these services that we don't just go down the medication route, because actually maybe it isn't always the best thing for the person in the long run, and we need to learn and develop and actually think big picture when we're helping people. So I just want to talk a little bit now about bipolar disorder. And bipolar disorder is about mood. So bipolar, opposite poles, we see extremes of mood. So we see very highs, great highs and great lows. And the highs and the lows don't come and go quickly, a bit like mood swings in a day. They can last for weeks at a time. And that for that person, there may be periods of really severe depression when they feel suicidal, when all the symptoms that come with depression are there, slowing up, not being able to function, thoughts of self-harm. And then there can be a swing, sometimes quite suddenly, to a great high. And that can initially feel like, oh, I'm better now. But actually the better becomes out of proportion and out of control. And I've had patients who tell me when they're in this mania phase, this manic phase, that they've been spending loads of money, they've been buying loads of clothes, they've had 5 takeaways today because actually they wanted to try lots of different things. They're functioning really well, they're up all night working, they've applied for loads of jobs. I had one student who told me she'd signed up for 10 different societies in a week because she was feeling so enthusiastic and passionate and excited about things. And it can seem like things are going really, really well for that person, but actually it's a marker of being ill. And a couple of things that can be really difficult in that time: people can run up a lot of debt because they spend a lot of money, and they can take part in risky behaviours. So all sorts of drug use becomes more likely. sexual relationships become more frequent and again out of proportion, excessive, and things around that that can bring damage to that person in that manic phase. Now, when we're helping people with bipolar disorder, we're using drugs that are mood stabilizers. So they're slightly different. Well, they are different. They're working to stabilize the mood, to bring a sort of equilibrium so that you don't get these extremes of mood. And they can be really, really effective. Now, with all these things, there's the question, why do they happen? Why does somebody get one of these illnesses? And a bit like it's difficult to label them or say what they actually are, it's also difficult to know why they happen. And basically we know some things that that are linked. We don't know a definite cause. So we know that things like adverse childhood experiences are linked. So trauma in childhood, abuse, breakdown in families, difficult relationships, things that happen, what we call adverse childhood experiences, are linked. We know that particularly for schizophrenia, drug use in teenage years is linked. We know that certain things trigger, so great stress, emotional stress, trauma that happens can trigger an episode. There's lots of discussion around whether there's a genetic element or whether it's actually environmental. It's that the person is growing up in a similar environment to other members of the family. We don't know for certain. There's also debate around chemistry in the brain. Is it actually fundamentally a chemical problem? It isn't totally that. Or is the chemistry deranged or abnormal because of the underlying thinking and symptoms that you get? It's a bit like a chicken and egg kind of thing. And we basically don't know. So what we can do in these conditions is to look at how can we best help this person. How can we best, going forward, help this person firstly recover and get to a place where they can function and they're safe, and they can carry on with life again. And then how can we keep them as well as possible so that further episodes are not likely to happen or less likely to happen. Now, often in that acute phase when people are really unwell, using medication is useful. It helps people stay safe. It helps them settle down. But in the long run, it's often the other things that are most helpful. So the talking therapies, the looking at, particularly looking back at maybe some of those things of childhood. What is it that happened? Has that been resolved? Has that person had counselling help and therapy help to help them look at some of the traumas that are there in the background? How can we help that person manage well when there's stressful situations? So you might not be able to control the situation that's around you, but how can you manage yourself well within it? Looking at lifestyle things, things like drug use and alcohol use, exercise, good diet, all those kind of things that give that person the best chance of staying well. So lots of bits of information in there. I think the other thing that I would want to just say in here as well is just around the spiritual side of things, because I always like to look at health and well-being as a whole picture, a total picture: spirit, soul, mind, emotions, body. And I think again, I've said before, we're not very good at doing that within the West. And I think it's really important in mental health conditions as well that we consider the spiritual side of a person, the spiritual part of the person, who they really are. And I can understand with these serious mental illnesses why there can maybe be a fear around doing that and a caution. And I think that's because sometimes people do present with what we call religious delusions, or there's a religious nature, a spiritual nature to the symptoms that they're presenting with. So, for example, I've had a patient who thought she was the Virgin Mary and was going to have Jesus, or people who think that they're saints, and that they're in this position where they can control things and order things, and it can be really difficult to to then talk to that person about spiritual things. You have to be really wise how you do that and careful, and make sure that that person's safe, and that you know that you're not dealing with someone who's still very, very unwell, and that this is part of the illness. And maybe within faith settings, within church environments or other faith environments, it's important to bear in mind that sometimes how a person is talking religiously or spiritually can be an illness, if it's in the context of these other things that are going on for that person. However, it's also really important that we don't throw out everything. And I know I've got a friend who's got schizophrenia who's actually found their faith in God, and knowing that they're loved and that there's someone greater than them who's in control and is there for them and loving them, that's been foundational in helping them recover and in staying well. And they've also got a really great community of support around them, people who really love them and care for them, and are there for them, whatever. And I think the whole spiritual side of things is really important to talk to patients about. Again, when I did psychiatry, I was part of a project where we were looking at asking patients about their spiritual backgrounds as part of just normally what we did on the ward. And that was really interesting, finding out what people said. And for some people, the illness did actually start when something traumatic had happened spiritually. So, for example, I had one patient who'd been and had tarot cards read to them, and it had been very frightening and scary, and from that various things had opened up, and some of their illness seemed to be connected into that in some way. And it's really important we ask those questions and don't become frightened of them or not ask them, maybe because we don't even believe ourselves that there's anything in that. So I think, again, with mental illness, it's really important we consider the whole person. And I think it would be great if that was included in our mental health services as part of the package for that person, that's something that can be looked at and they can be supported in if they want to do that. So I think this is a really important thing that we talk about, that we know about. It's great that people, in the media have started to talk about things like, bipolar disorder, people like Stephen Fry, to actually have it out there, to have it as something that's not a stigma, that is an illness in the same way as a physical illness is an illness, and that we understand a little bit about it, so that then we're in a position so we can support and help people who are struggling with these things. So I'm going to finish there. I will put some links on the website for things that might be helpful to you, places where you can look up information and get a bit more background if you're interested, and some links again to some of these projects that are looking at other forms of therapy as well as medication. So in the next couple of weeks, to finish off our mental health series, I'm going to be looking at voices. I'm going to look in a little bit more detail at the voices and what we listen to and the thoughts and what we agree with. And I'm also going to have a little look at something called dissociative identity disorder. It's nothing to do with schizophrenia and split personality. It's a completely separate thing, and those two things will be coming in the next couple of weeks or so to finish off our mental health series.